We have two major programs that I guess are frequently described as training programs at the Cook Center. I think that term is not adequate, but for the time being, I will use it and I would like to describe them. One of these is the Diversity Initiative for Tenure in Economics, which is a program that facilitates the transition of junior faculty members in the field of economics to becoming associate professors with tenure. And I'd like to ask all of the DITE fellows who are here to please stand. There's quite a few of them. You're here. Thank you. The other training program that I would like to mention is the Hank and Billy Suber Aaron Summer Research Institute for Young Scholars. And this is a program that has been designed for the purposes of providing high school students with the opportunity to do original research on questions involving inequality. And they spend approximately 3 weeks each summer with us working on their projects. And we have a culminating event in which the most advanced students make presentations of their work. We also have other students who do poster presentations. And I want to invite you to the spectacular poster presentation that's going to be had by a number of scholars tomorrow evening. But let me just say that because the Aaron Institute is named after Hank and Billy Suber Aaron, we are thrilled that Mrs. Aaron is here this evening with us, and she's going to do us the honor of introducing our dynamic guest speaker. So, Mrs. Aaron.
Thank you. Do you expect me now?
Yeah, please.
Okay.
There's a small step here.
Thank you, Dr. Darity. And thank you, Dr. Gwen Wright, and to all of you who are associated with or affiliated with Duke University. It's my pleasure to be back with you again. I've spent a number of evenings with you prior to this event, and I'm delighted to be here again to introduce our guest speaker. So as I get my papers in line, I want you to know that I brought a little support from Atlanta with me, and I'm delighted to have them. Of course, always it's the Cook family, Miss Sylvia Cook and her daughter, Karen. I didn't bring them here, they came because they are affiliated with this institution. I was here some time ago, as some of you may remember, before Dr. Cook passed, to give the keynote address upon the opening of the Dr. Samuel Cook Center for Social Equity. I'm very, very proud to be affiliated with that organization and to have this opportunity to speak with you briefly as I introduce the speaker for the evening. It must be borne in mind that the tragedy of life doesn't lie in not reaching your goal. The tragedy lies in having no goal. to reach. It isn't a calamity to die with dreams unfulfilled, but it is a calamity not to dream. It is not a disaster to be unable to capture your ideal, but it is a disaster to have no ideal to capture. It is not a disgrace. I didn't get them quite together. To reach the stars. But it is a disgrace to have no stars to reach for. Not failure, but low aim is sin. Those words from Dr. Benjamin E. Mays, who was the president of Morehouse College for some 27 years, I believe, were delivered every Tuesday morning, perhaps not the specific words, but he spoke to the Morehouse men every Tuesday at chapel. And they were fed those words. They grew up on those words. And those words were apropos to Dr. Samuel Cook, to Martin Luther King Jr., and to any number and all of the Morehouse men. One other quote that I would like to make is this. He did not write these words, he told me, but they were anonymous, and they are. I have only just a minute, only 60 seconds in it. Forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, but eternity is in it. Those were words that were often quoted by Dr. Benjamin E. Mays. I share these words with you because our guest speaker for today grew up at Morehouse College, attended Morehouse College for some 4 years, I guess. Maybe he might have gotten out sooner because he's so brilliant. He might have finished in 3 years, or for that matter, in 2 years. I'm not sure. But he was introduced to those words. He listened to those words quite frequently, I'm sure, that Dr. Mays gave to his students. He fed them well, all of them. And they all, to a man, I believe, can probably point to these words at some point in their lives to associate themselves with the teachings of Dr. Benjamin E. Mays. Now, Dr. David Satcher and I met many years ago at Morehouse when he was a student in an exercise class. I dropped out because I couldn't keep up. But he stayed in, and along with all of the work that he did at Morehouse, he continued his outlook on health and healthy eating and healthy drinking, for that matter. But David was well known on campus. At the time, as I recall, Dr. Charles Meredith had organized this exercise class and had invited those of us who were on the staff at Morehouse to participate. And of course, that we did and loved and enjoyed, along with Dr. David Satcher. Dr. Satcher was born in a little town called Anniston in Alabama. Anniston is within 100 miles of Atlanta. I don't know exactly how far. But it, too, is, was, and will always be one of those little southern towns that have always put barriers in our way and that always saw us a little differently from the way they saw themselves. David Satcher is lucky, is blessed to be here. For at age of 2, he contracted whooping cough and pneumonia and was not expected to live. There was a black doctor in the community, a Dr. Jackson, who advised his parents to do what they could to make him comfortable, but that he didn't think David would make it. Around that time, and growing up in a very religious community, growing up with parents, though uneducated, were Christians, true Christians. You all don't know what Christianity means. I know you don't. Most of us don't. But true Christians who believe, practice Christianity. And through their prayers, their singing to the glory of God, and to asking God to save this child who was then 2 years of age. He came through. He survived. Perhaps because of the love and appreciation that his parents had for the Almighty, and perhaps because of all of the prayers that were sent up in his behalf, but he survived. And then when he became 5, he knew the story of his survival. His parents had shared with him the fact that he was not expected to make it, but he did, with the help of God, he did. Following all of this teaching and his upbringing, he wanted badly to meet this Dr. Jackson. Dr. Jackson had since passed, but he knew Dr. Jackson was a doctor who could not admit David into the white hospital because they didn't take blacks. You didn't have a hospital to go to. And you were lucky that you had one black doctor in the community, because otherwise we were not attended to. We were not given medical treatment. We survived on a will and a prayer. And fortunately, David did survive. And he said, I want to be a doctor. I want to be a doctor just like Dr. Jackson. I want to save people just like Dr. Jackson saved my life. After entering Morehouse College, he majored in the STEMs. I don't know which one, science, chemistry, biology, or whatever, but in the sciences. And he graduated from Morehouse. I believe I read that graduation took place in about 1973, maybe. I'm not sure.
63.
63, excuse me, I mean 63. In 1963, he graduated. That puts him a little older than you thought. So anyway, he graduated and went on to Case Western University, where he received his MD and his PhD. He received, and I'll repeat that. I know you didn't hear it. He received both his MD and his PhD. Thank you. That takes, I don't know what it takes, but it takes more than I can describe. He obviously was a very bright and talented young man who had a vision, for becoming a doctor, who had a vision for becoming the kind of doctor that could help people. Now, his list of accomplishments and his list of outstanding jobs, none of which it would take too much time because we got to hear him. But he has just gone up, up, up the hill all the way. And he has been a staple in our community. He has done so much that I won't take the time to describe it. If he chooses to let you know something of it, he can. The last thing you probably heard of him was when he was best known as the Surgeon General of the United States of America. He was the Surgeon General. This little 2-year-old who might have lost his life, who might not have been in a position to get further help and to survive whooping cough and pneumonia, became the Surgeon General of the United States of America. Ladies and gentlemen, please welcome the former Surgeon General of the United States, Dr. David Satcher.
Thank you. Thank you. Thank you.
I'll take this a loose.
Well, thank you very much. I must say I'm delighted to be here, to be able to join you on this occasion, because we have, I had two mics, so I didn't have any excuse. But I do want to say sincerely how pleased I am to be with you, how much it means to be a part of a program named for Samuel DuBois Cook. We have deep roots together. When I was telling somebody earlier, but when I was president of Meharry, I believe it was, and Sam was president of Dillard, the president of historically black colleges, especially the larger ones, decided to get together every 3 months to really plan together fundraising and changing, things. And Sam Cook was a leader in that group. But I was very fortunate. As you've heard, I have a history of being very fortunate. But being in that group, with that group, really gave me the kind of support that I needed as president of Meharry at a time when most people thought Meharry was going to close. But Sam Cook was one of those people who was always there to contribute to whatever our role was, not just Dillard, but Meharry and others. I do want to thank Billy for that introduction, because I knew the introduction would be better than the speech. So, see, I've known her for quite a while. And so, really, thank you for that. I'm going to be fairly brief, because I think with that introduction, you've already heard a lot of what I believe and what I stand for. And I want to keep it. But I'm going to use some slides. I don't know whether you use slides here very often, but as Surgeon General, I had the opportunity to release 14 reports. And I'm just going to mention a few of them. how to, well, I can do it without them, but I wanted to, I don't want to talk about every one of the reports, but I want you to get a feel for what I was concerned about as Surgeon General of the United States. But I don't know how much you know about the Surgeon General's position. It's a very special position, and there is no position like it that I know of in any country in the world. And so it sort of occupies a very special place. And it also has played a major role in the eradication of diseases. You know, we've only eradicated one disease. Does anybody want to help me with that one? Smallpox. Smallpox, that's exactly right. And the eradication of smallpox had a lot to do, of course, with vaccines, right? Vaccination. And I say that because I know that today there are a lot of people who don't want to be vaccinated, don't want their child to be vaccinated. But all of the evidence would suggest that vaccines have been, if not the most effective weapons against disease, certainly one of the most. So a lot of lives have been saved because of our ability to immunize or vaccinate children. When I was director of the CDC, we had, parents who questioned whether their child should be immunized. But in time, we were able to get measles, mumps, and rubella. This one?
Yes. Arrow on the right. Yes.
It's probably just me. Is it? Yeah. Don't worry about it. I can do it with that. Okay. But anyway, a lot of children have been saved because of vaccines. And as I said, in 1978, we eliminated smallpox. Oh, okay. But I wanted you to see some of the reports that I had the opportunity to release as Surgeon General. And as you can see, they sort of span the gamut when it comes to public health. And I want to talk about public health just a little bit because how many of you have worked in public health? How many of you work in public health? Yeah. Public health is very important, and so it works only when they have the projector back there, I think. But I don't want you to forget the definition of public health. Public health is the collective efforts of a society to create the conditions in which people can be healthy. But those are some key words. It is the collective effort. So it's not one person, it's a collective effort. And it's not just to give medication, it is to create the conditions in which people can be healthy. Those conditions can mean a lot of things. They could be getting rid of pollution, getting people to stop smoking. And you remember that one of the first reports of the Surgeon General was in '64, and that was the Smoking and Health by Luther Terry. And we estimated 2 years ago that over 1 million lives had been saved because of people being able to quit smoking. And Luther Terry was the Surgeon General who released that report. But this is, we mentioned smallpox, a major killer. A third of the people with smallpox back in the turn of the century, a third of them died from the disease. But as time went on, the vaccines made a big difference. And by 1980, we were able to declare smallpox eradicated. Because there's a difference between eradicating a disease and eliminating it. You can eliminate a disease and still it's not eradicated as long as there's one case a year anywhere in the world, it's not eradicated. So when we say eradicated, we really mean that that there's no danger of you getting that disease regardless of where you travel. But I mean, when you say that, then you think about the fact only one disease has been eradicated. Now recently, and I think the next slide, this is smallpox, of course, and we've probably come closer to eradicating smallpox than any other disease. Some of you remember smallpox, right? Could I see the hands of everybody who's seen a case of smallpox? I'm sorry, I meant polio. The hands of those, so just about every hand should have gone up. But polio is a disease of the nervous system, and it causes crippling. And I had classmates who had polio. So polio is not gone, it's still with us. But because of vaccination, it's not as common as it used to be. Next slide. Now this is the good news. And when Africa was able to announce the milestone of having not eradicated, but eliminated polio. And more recently, it was announced that there's not a single case of polio in the world right now. But you can't declare it eradicated because the World Health Organization's rule is you have to go at least 2 years without a case anywhere in the world before you can say you've eradicated. And that's what we did with smallpox. And that's what we have to do with polio. Well, I wanted to, when I became director of the CDC, one of my concerns was, obviously everybody knew that I was concerned about the fact that African Americans are disproportionately affected by many diseases, right? And so we set out to make progress there. But I wanted to go beyond that because there are other groups like the American Indians who also have some serious problems with various diseases. And one, of course, is diabetes. So when I was director of the CDC, I remember wanting to get money from Congress that would allow us to try to reduce diabetes in American Indians. So I invited Newt Gingrich, who was the Speaker of the House. We weren't friends, but he came, and my staff had told me that, he won't stay long. He'll probably be here for 15 minutes, and then he'll say he has to go. But we did our research and found out that Newt had people in his own family with diabetes. So when we presented to him the nature of our concern for diabetes, he spent 2 hours with us. And when he left, he promised that he would get the money for us to launch a program to reduce diabetes in American Indians. And he did. He followed through on it. I hope you can read these lines, but it tells quite a story. A story of from 2010, and it really goes beyond 2013. But and by the time this was over, of course, I was no longer director of CDC. I was Surgeon General. But as you can see, Native Americans have more diabetes than any other race or ethnicity, and 16% is the prevalence. Kidney failure is one of the major outcomes of diabetes. So in American Indians, we have a lot of kidney failure. And if you read these lines, some people read lines better than others, but you can see how the rate of renal failure in American Indians dropped from the height of 60 per 100,000 down to about 25 per 100,000. A lot of progress, and that's just the beginning. We still have a lot of work to do. But what we wanted to demonstrate was that we could, in fact, reduce disease in African Americans, in American Indians, et cetera. As you can see, we still have far too much diabetes in American Indians. But we're making the kind of progress we need to make. Next slide. I'm going to, the topic, which I didn't dwell on, but I think is important, the topic is science matters. Yesterday, today, and tomorrow. Science matters. Science does matter. And you don't have to be a major in science for science to matter to you. And that's the attitude that you need to, I think, take with your children and grandchildren. Science is something that we all need to celebrate, to try to understand, and to try to use to improve health of all people. And so that's what this is about. However, 5 years ago, I believe, I started to talk about the highs and lows of public health. And one of the high points of public health would be what? Eradication of smallpox. Certainly one of the high points. This was one of the low points. It was when black men in Tuskegee, I think there were 623 of them, were led to believe that they were being treated for syphilis when they were not being treated. And this went on for 40 years, from 1932 to 1972. When I became director of the CDC in 1993, one of the first things I had to deal with was a committee report. Whatever happened to those black men who were studied but not treated? It's not the only situation of what has happened, of course, but I think it's important to know that there have been some really low points in the history of public health, and they've been related, many of them, to racism, to people making a difference in terms of how aggressive we treat. And that's why, as director of the CDC, I was determined that we were going to go after kidney failure and diabetes in American Indians as well as in African Americans. These men, if you count them, I think there were 5. There were actually 6 there at the meeting. Because when I received the report, they recommended that there be an apology, a national apology for the Tuskegee study. And I picked up the phone and called Donna Shalala and President Clinton. And President Clinton said immediately, I agree that we need a national apology. You can't have public health if people don't trust the system. You might as well forget it. I'm not just talking about vaccination, I'm talking about public health, the collective efforts of a society to create the conditions in which you can be healthy. That's what public health is. But these men, it's amazing, 40 years later after the study started, most of the men were deceased. And so there were only about 8 to 10 left. 6 of them were able to come to Washington for the apology. And as you can see, one of them went to the bathroom or something. He was not there when President. But if you want to read something that's really interesting, you might want to go back and read the apology that President Clinton issued for the federal government, for the public health service, for what had happened to these men and their families. So we're not there yet. I mean, still a lot of things that we have to change, but we've got to keep working at it. Next slide. Now this is Luther Terry, who released the first Surgeon General's report on smoking and health. And that report came out in 1964. And this is Luther Terry holding up his report. When I was director of the CDC, I met Dr. Terry's son, Michael. And we used to talk, and he said, well, you know, my dad was a smoker. I didn't know that Luther Terry was a smoker. But the story is that when he released his report, it was on a Saturday morning. Now, often people will schedule things on a Saturday morning when they don't want anybody to be there, no press, as opposed to a lot of people writing it up. So anyway, he issued his report on a Saturday morning, and the story is that he was riding in the back seat of his car with his assistant, and his assistant said, well, Dr. Terry, you know the first question they're going to ask you when you release this report? Dr. Terry thought about that, and he said, no, what's that? He said, well, they're going to ask you if you smoke. And Dr. Terry said, oh, they wouldn't ask me that. Why would they ask me that? So he went on to the press conference, did just an outstanding job of releasing the report. First question, Dr. Terry, do you smoke? He said, no, I don't. And so the reporter had done his homework. So he said, well, Dr. Terry, when did you quit? And Dr. Terry said, I quit 30 minutes ago. He never smoked again. You know, if he smoked, he hid from everybody. Wow. Okay, next slide. Well, as you probably know, a major effort of the Morehouse School of Medicine, especially with our current president, is the whole issue of eliminating disparities in health. I think most people would say that we among medical schools in the country are leaders when it comes to working to eliminate disparities in health. And so so it's important to know what disparities are, and that's why we take the time to talk about them. The differences that occur in health by gender, race, ethnicity, education, income. It can be in any of those things. It can be sexual orientation, because there certainly is a difference in the risk for HIV/AIDS, depending on sexual orientation. So the goal of eliminating disparities in health includes a lot of areas. Next slide. This is one of my favorite slides because it tells you so much about what disparities are and how to eliminate them. Would somebody else like to tell what this says? I know, I'm sorry?
Equality doesn't mean equity.
Yeah, it says that, but what is the symbolism? You're right, equality does not mean equity.
It means that we have to create the opportunities for people
Exactly.
to access.
Exactly. It's having the opportunity to be healthy. And so we're not equal if we don't have the same opportunity to be healthy. If there's no doctor around, as Ms. Aaron talked about, Dr. Jackson, but that was discrimination. He couldn't admit patients to the hospital. It was a struggle. But there are a lot of other examples today, maybe financial, where people don't have access to health care. But as you can see, you got to make the opportunity. And these people were not equal in terms of opportunity because they were not the same height, of course, and therefore some of them needed higher boxes than others. And that's what this shows, what happens when you create equal opportunity. Okay, it's one of my favorite slides, and I didn't create it, somebody else did. Nobody would tell me who. Okay, but this is work that we did at the Morehouse School of Medicine. Some of you remember Dr. Russ, who is now at Florida State up there. But the two of us led an effort to really look at what would have happened if we had eliminated disparities in health. And for one thing, 83,500 fewer black deaths would have occurred in 2000 alone. The year alone. Think about that, 83,500 if African Americans had the same opportunities in terms of access to health care. But not just health care, right? Because what we found a few years ago was that a lot of young people, teenagers, younger, grow up without safe places to play, right? Now, I don't want to use that as any excuse because there is no good excuse for not being physically active, and yet most people are not physically active. So that means that it's not equal. But young people, children, deserve an opportunity to be physically active in a safe place. And if they don't have that, then they're not going to be as physically active. Next slide, I'm going to move. I didn't cover all of those. Well, can you give me back that slide? I'm not going to cover the whole thing, but you can see 24,000 fewer deaths would have occurred from heart disease, 22,000 from diabetes. See, just think about all of those areas where are different. Go back to the slide with equity and equality, and you see how it plays out when it comes to differences. So that's what we should be about. We should be about creating the opportunities for people to be healthy. And that includes not just access to the hospital, which Dr. Jackson didn't have, but also access to quality health care. Next slide. Did you skip a slide? Okay. Down at the bottom, and I'll go fast through this, 2.5 million blacks, including 620,000 children, are not covered by health insurance, who should be covered. So there is disparity in terms of who has access to health care based on who has insurance coverage and things like that. Next slide, I'm going to go on and finish. one of the things I was asked to do by the World Health Organization, it was the year before I left Washington, was to join a commission on social determinants of health. And we went all over the world looking at different countries in terms of how social conditions affected health. And we produced a report when that was over. And you can, if you want to, I would recommend if you are in public health especially, that you go back and read that report on social determinants of health. Social determinants. The guy who heads the Satcher Health Leadership Institute at Morehouse now, does anybody know who that is? Who heads the Satcher Health Leadership Institute? You gotta be kidding. Okay. No, his name is Daniel Dawes. He's a really outstanding young man. We're very fortunate. But he has written a book entitled The Political Determinants of Health. The political. And he really, as somebody who spent 12 years in Washington, which Daniel did, looking at how laws are made and things like that. And now he's trying to use that to promote this. Next slide. I'm almost there. I am going to take a minute to say to you that one of the areas that's been most neglected in public health is mental health. Mental health. Among our children, in families, there are families who won't seek treatment for their children if they think they're mentally ill because they think they're going to be blamed. Let me tell you something. Just as things go wrong with the heart, the lung, the kidneys, and the liver, things go wrong with the brain. They always have and they always will. The only question is, how will we respond? Because if we respond on a timely basis, we can intervene. The brain is an organ just like all other organs in the body, and in many cases, we can prevent future deterioration. And I'm not talking about just preventing things that happen on the football field, which we need to be concerned about too in terms of the brain. Well, in 1999, I released the first ever Surgeon General's report on mental health. Mental health, a report of the Surgeon General. Then in January 2001, we released Children's Mental Health. In 2001, we also did Culture, Race, and Ethnicity. So you might want to go back and read the summaries of these reports when you get a chance, because they can really come in handy, especially for those of us dealing with children and grandchildren, because mental illness is real. Next slide. What is mental health? It's being able to engage in productive activities, the ability to adapt to change, successfully cope with adversity. We all have adversity, but the ability to successfully cope with adversity is mental health, and fulfilling relationships. Think about those four things. You see how important mental health is. We estimated in that report that 50% of all dysfunction is related to mental health problems. When you think about all of the things that happen to us on a day-to-day basis, about 50% are related to mental health problems. Next slide. This was after I had left government, and President Obama deserves a lot of credit for pursuing this mental health issue and making mental treatment for mental illness more available to more people. That's what these three things are all about. And we've come a long ways, but we still have a ways to go when it comes to making sure that everybody has access to mental health care, and including our children. Because just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. They always have and they always will. The only question is, how will we respond? How will we respond? And if we respond appropriately, we'll save a lot of pain and suffering. Okay. Any questions about? These were the three main components of the Affordable Care Act, which passed under President Obama. And Patrick Kennedy, who works with me at the Satcher Leadership Institute, and is one of the grandsons of the Kennedys that we know best. But there is at Morehouse a Kennedy-Satcher Security Act in the program which we run. And Patrick Kennedy and I had that. But it will go on long after we are gone, I guess. Next slide. I'm going to end with this, and I'm just going to say, ultimately, you know, we're concerned about how much stuff costs, right? Well, what this says is that we could save $278 billion a year if we didn't have to treat, and if we didn't have to deal with mental health issues. Crime, a lot of things that happen that wouldn't. So the cost is amazing. Excess deaths, 116,000 a year. And as I said, $278 billion a year we lose because of mental health problems. Next slide. Okay, next slide. I'm going to go on and finish. But I do want you to, Ms. Aaron was talking about physical activity, one of the most neglected areas of our lives. We're not physically active. We're not doing justice to our brain, to our body, rest of our body. See, studies show that physical activity reduces depression, elevates mood. Physical activity improves mental acuity. Physical activity reduces stress and anxiety. Much better than a lot of the drugs that people use. And much safer. It improves sleep. You go on and on, but these are things that we can do for ourselves to improve our health. Next slide, Okay, so that ends my presentation, but let me just say, when I became Surgeon General, I wanted to have a prescription for the American people. So I picked 5 areas. Physical activity, which Ms. Aaron talked about. It's very important, and the difference it could make if each of us would make a commitment to regular physical activity, whether it's walking or jogging or swimming, it would save a lot of money in terms of our health. Eat at least 5 servings of fruits and vegetables a day. Avoid tobacco, illicit drugs, and the abuse of alcohol. Responsible sexual behavior. Daily participation in relaxing and stress-reducing activities. Any questions about any one of those items? That's a prescription. That's what that is. It's a prescription. You follow that prescription, and I guarantee you, your health will improve. Okay. Is there one more? That should be the last one. This is what we say at the Satcher Leadership Institute. If somebody asks us, well, who do you decide, since you're a leadership institute, how do you decide who should be prepared to lead? And we point to 4 things. One, we're looking for people who care enough. Care. Because if people don't care, then, we're not going to be successful. And a lot of people don't care, unfortunately. Know enough. And that doesn't mean that they don't need to be trained. It just means that they know enough to know that there are certain things that are required for leadership. People with courage, the courage to do enough, and leaders who will persevere until the job is done. That's the Satcher Health Leadership Institute's motto. Next slide. And that ends my presentation. Thank you. Should we have questions?
No, thank you very much. This is terrific.
Okay. Thank you. Thank you. Thank you.